Arturo Casadevall, who joins me from Baltimore, and he's a professor of microbiology, immunology and infectious diseases at Johns Hopkins Bloomberg School of Public Health. Great to have you on the program. Tell us, Doctor, how hopeful should we be about this plasma treatment?
Thank you, Maria, for having me in your program. We should be hopeful, but the important thing to always think is that this is a new virus, this is a new situation, and the therapy needs to be tested, and it needs to be tested to determine when, how, and if to use it.
And this isn't anything new, the use of plasma, but how hopeful are we with the cases right now at Mount Sinai Hospital? I understand 20 very sick coronavirus patients have been injected. When could we see any first signs of hope?
So you're right, this is not a new therapy. It's been used for over 100 years. It involves taking plasma that it contains antibodies that kill the virus. As to your question, I think we're beginning to see results from China. There was a paper published yesterday in the Proceedings of the National Academy of Sciences in the United States that again was encouraging. I think that the earliest information will be a few weeks from now.
And what else can you learn from China?
We can learn a lot. They went first and they have a lot of experience and they're sharing it with the world. And in particular, we're learning how to use the convalescent plasma by reading some of their early reports.
And time frame wise, we're always looking at when could it be available for patients suffering from COVID-19?
Maria, the idea is simple, and it is already being used. It's been used in the United States, it's been used in Italy, was used in China. The problem is logistical, that it takes a while to identify people who can donate, collect their plasma, and then use it in those who need it. But we're getting better at it each day, and we are hoping that be a greater supply in the days ahead.
And how forthcoming are people? I saw that the brother of New York Governor Chris Cuomo said that he would donate plasma. But how forthcoming are people, and how many people do you need?
So people have been very forthcoming. My inbox is filled of people who want to donate in the United States. There are now places in which you can go and donate. So I think that the finding donors is not going to be a problem. The problem is going to be energizing how to do this. It takes some time. And I think that this is one way by which those who survive can help those who come afterwards. One person may be able to treat 2 people or 3 people, depending on how much plasma is obtained.
And Dr. Arturo, I just want to take you back to the good news that we've seen from China. Wuhan has come out of 76 days of lockdown. What more can you learn from this? What are the good news stories that come from Wuhan for the rest of the world? Because we're looking at this area with a lot of attention and a lot of hope.
I think it's wonderful news. I think that it shows that with discipline and maintaining public health measures, that it is possible to get on top of this epidemic. I'm very optimistic. I think that we're going through a very difficult time. Humans are. But I believe that in the future, we will vanquish this. There will be vaccines, there will be drugs, there will be antibodies, and one day we'll be able to put this behind us.
And so what else is being tested? We've talked about plasma. You mentioned very briefly there vaccines. Would it be a combination of both?
Yes, I think that when it comes to something so complex and deadly as coronavirus, that we're going to need multiple options. I don't think one thing will do it. Vaccines are still way off in the future, maybe a year and a half from now. Drugs are being tested, and hopefully some will be found to be effective. Antibodies are under development. Plasma is available now, although the problem with plasma, as I mentioned, is that it needs to be tested, and the supply is still very limited.
Okay, Arturo Casadevall, thank you so much for coming on the News Hour. Really appreciate your time and your insightful comments.